So today we're talking about what is a good situation if you're needing care, you've reached a point, your health has gotten to where somebody needs to help you, you need a professional caregiver or a family member caregiver that's going to help you with the activities of daily living. And so we're talking here about what is a good situation made out of a bad situation, which is you needing care and you able to stay in your home. I mean, that's what certainly I'm after in planning my future retirement. If I do need care at some point, I'd like to stay home as long as I possibly can. And I'm going to need both a care manager and I'm going to need a caregiver. So, talking a little bit about that is if you wish to age in your home receiving care from family members, it's very difficult. There's a lot of people that we run into that are just relying on that. You know, if I need care, my wife's going to take care of me. If I need care, my daughter's going to take care of me. And she's going to do it at home. And first of all, I'm going to tell people is that's not necessarily a practical situation. If you and your spouse are the same age or close in age, and this is happening when you're 85, now you're talking about an 84-year-old woman being your full-time caregiver, keeping you at home. So I don't want to get into the nuts and bolts of the thing too much, but that's what we're talking about today is having a care manager and having a caregiver. And the caregiver is a person that's hired by an agency, by a home health care agency. So I want to bring Tom on and I want Tom to talk about why we're doing this video.
Yeah, I mean, we're doing this video because if you haven't experienced this, or you don't know a loved one that has gone through this, you don't know what a day looks like of staying home and providing care. So we want to walk you through a case study of what that looks like, what a day at home looks like for someone needing care, who's providing what services, are you relying on loved ones, a child, a spouse, whatever that looks like. We just want to give you some realistic guidance of what that looks like because like I said, if you haven't lived through it, it's surprising. It's hard. You're in a crisis moment as a family. And so you need to do some thinking and it's really trying to determine what am I signing up my loved ones to do if I don't do proper planning for this. And so let me bring up the show notes here. These are at the link below our video. They're also on our website at cardinalguide.com. We have the board sort of listed out so you can print it out, look at it a little more closely if you need to. But I just want to walk through. I'm not going to read every line here, but we really have two columns here on this chart. One for a caregiver. This is the person who's actually providing the care to you or to your loved ones. And then there's the care manager. Really, this is really more of an informal care manager because there is a technical person who is trained to be a care manager. Really, what we're talking about today is an informal care manager, often, a child or a spouse who's actually managing what's going on. But I just wanted to give you an example of like in this case study for a day, we have 8 a.m. to 8:45. The caregiver is helping with bathing assistance. They're helping the shower, sponge bath, toileting. I mean, really, actually, literally taking care of this person, of you potentially who's needing care. Whereas the care manager during that time in the morning, they're out walking, they're out, going doing yoga, whatever the activity is, they're out actually able to live their life because the actual caregiving is very time consuming and very hard. And if you're trying to do both roles or you're signing up your family to do both roles, their life is going to be all consumed with taking care of you, right? They're going to have very little time for you. What that practically looks like is a child having to stop working to take care of mom and dad, them having to, cut back on what their future retirement is because they're not able to save while they're doing that. If you haven't planned financially for it, them having to come out of pocket to help pay for some of this stuff. I mean, it just gets ugly really quickly. I'll do another example. Down here is from 9:15 to noon in this case study. The caregiver is doing chores around the house, laundry, bedding, doing just housekeeping essentially. The care manager who's overseeing all of this, they're out at coffee with a friend, they're out gardening. I do want to make the point, there's the time, breakfast time, dinner time, during the night, your loved one is still there providing care during that time, right? The caregiver, this isn't an example of a 24-hour situation where they're giving care 24 hours a day. So they're still involved. They're going to be still involved there, involved in your life, really looking after you. But it's also gives them space to live their own life too, and not be all encompassing of just taking care of you at the detriment to their own sort of well being. And what happens a lot of times is the healthy spouse or the child, they end up getting sick themselves because they're just overexerting themselves taking care of you. So I just really want you to think through what this looks like, what it is that you're signing either a loved one up or hopefully hiring someone to do the heavy lifting of the caregiving and allowing the family member to be sort of a case manager.
Okay, so what we want to talk about is these two roles. Is what are they? A caregiver is direct hands-on assistance with ADL. So the caregiver is the person, activities of daily living or bathing, dressing, eating, transferring, toileting, and continence. And two of the six are required for long-term care insurance to pay. And that's what a caregiver does is they do assistance with those six ADLs. They also do personal care, meal prep, light housekeeping, companionship, medication reminders, basic health minor. And the training is at varying levels, and most of it is done through home health aides. And I will point out that there are volunteer organizations that if a family member has to give this kind of care directly just because of the money, and they will provide training so that you can at least do it properly. But what we're illustrating on this video is why you really need home health care insurance, something that will pay out money, because these are expensive to hire a professional agency caregiver. Now, the care manager is generally, in the technical sense, is a professional like a licensed social worker, an LSW, and they're going to do assessing of the individual. So before they send a caregiver out and somebody to do the home health aid, they're going to have a professional come in and do an assessment and just see if you really need this kind of help. And then if you do, they're going to recommend one of those schedules like we laid out, and how many hours a day do you need it, and what are they going to do during those hours. And typically, they're going to be monitoring quality of care, advocating for the individual, support to family members. So, and in the chart that Tom went over, what we were showing an example where the care manager is really an informal care manager. They are the family member. And that was a spousal situation in the case study that we had. And it really just boils down. My plan is that if I get sick and my wife is still healthy, we're going to be in our home. We're going to be hiring professional care. And then she's going to, in effect, be the care manager and then the caregiver during the off hours. And we're going to see how that works out. But it is just very important to be able to hire these professionals, because if you don't do that, I've just been in this situation hundreds of times where people have brought, over a 47-year career where I specialize in helping people with estates, with their parents, with their spouses, with Medicare, and all the kind of things that we do in financial planning. We just get brought into situations where this is going on right now, maybe with their parents, and I just see a lot of women taking care of their husbands, and after some period of time, we got two sick people that we got to deal with. I also see people that have already moved into a retirement home, and a very nice retirement home and facility, a continuing care retirement community, and these places are really nice. And we got husband and wife there. One of them is in poorer health than the other, and when they reach a point of really bad health and they need assistance, they're going to require them to move from the part of the facility that has a gym and has a pool and goes on activities over to the assisted living, both of them. And if they're already there and they have home health care insurance that'll pay for it, not pay for the facility of the retirement home, but it'll pay for home health care, they can actually bring somebody in to take care of the person who's not well. And that allows the other spouse to engage in activities to have a life, essentially. So we really wanted to walk you into the situation that we've lived and seen 100 times or more of people. And it really, we still, in 38 states, we have a home health care policy that's just a standalone home health care policy. That's all it pays for. It doesn't pay for facility care. And it's much less expensive, fairly easy to qualify for. And in the 12 states where we don't have a standalone home health care policy, we have a long-term care policy that we can boil down to give you some kind of coverage so that you can stay in your home and so you can have insurance that's going to pay for these aides to come in and make it a practical situation for your family to look after you. So I'd like to bring Tom back on and talk about really, Tom, what do you have to say just in wrapping up here about this whole situation?
Yeah, I mean, I want to go back to one of the first things I said. If you haven't lived through this, you really don't know what this looks like. I mean, I've talked about my situation on previous videos where I got sick, my wife was taking care of me, and it played out exactly like we see it play out with our clients. She was, at that time we had an 8 month old. She was taking care of the 8 month old, having to be the care manager and caregiver for me. So she's running around trying to keep the house going. My job, I mean, I was sick, it was hard, but all I had to do was really try to get better, and at some level her job was harder than mine, and she ends up getting sick during that time, and it happens all the time. And people say, oh, we they hear that. If you've lived through this, you know that this is sort of a crisis moment, and you just need to do some planning, advanced planning, forward looking, to prepare if this happens. Our goal is for this to happen to none of our clients, right? We wish this happened on nobody, but realistically, there's a large portion of our clients that are going to face some level of this. You need to have some plan in place to how to handle that. So I just encourage you, if you haven't thought through this, really sit down and be honest with yourself of what this would look like, who's going to provide that care, and do you really want them to be the ones having to take on that role of caregiver if that's truly what your current plan is. So just think through that. Call us. We can help walk you through and look at some of the options of how to actually fund sort of this plan that we would lay out in terms of providing the care.
Okay, within the context of financial planning, that we do holistic financial planning, we've talked today. I mean, if you need long-term care and you're paying for it yourself, your Social Security check is going to be gone through the first week of the month. Medicare doesn't pay for long-term care. It pays for skilled nursing care and skilled home visits for a short period of time. We're not talking about that. We're talking about over a long period of time, helping you with the ADLs. Obviously, this whole talk is about long-term care, and then your 401k and IRA is really in play here because it's going to be spent on all this stuff if you don't have proper insurance. So with that, I want to tell you, I'm Hans Scheil.
And I'm Tom Griffith.
Thank you very much for listening.
Thank you.